Hi everyone, thanks for joining us today for this webinar on how genetic testing can help with depression treatment. My name is Emily Scahill. I'm the Manager of Public Education and Awareness at Mental Health America's National Office, and I will be moderating today's webinar. Some notes before I introduce you to our presenters. All participants are muted and unable to turn on their microphone. We are recording this webinar, and I will send that out to everyone along with the slides within a week. And we do not offer CEUs, but are happy to provide a certificate of attendance upon request. So I'll post the link to request one in the chat and in the follow-up email as well. And last but not least, we have built in some time for a Q&A at the end. So drop any questions in the chat throughout, and we'll go through some at the end. And feel free to use the chat box to say hi and let us know where you're from, as well as make comments throughout the presentation. And now I am so excited to introduce today's speakers, Dr. Holly Johnson and Ronnie Shapiro. Dr. Holly Johnson is the Senior Manager of Medical Information at Myriad Neuroscience, for the makers of the GeneSight Test. Her focus is on medical information strategy, medical content development, and healthcare provider consultations and interactions. She leads her team in providing quality education to healthcare providers, patients, and internal stakeholders. Dr. Johnson received her PhD in neuroscience from Mayo Clinic, and then did postdoctoral research at St. Jude Children's Research Hospital. Her research has primarily focused on mechanisms of blood-brain barrier disruption in neurological disease. Ronnie Shapiro once said, "I didn't go looking for depression, but I certainly wasn't going to let it define my life without trying to fight." 10 years ago, she was suicidal, at the bottom of a black hole, wanting to end the pain, but knew I couldn't leave my kids. I was willing to do anything to survive. Over one 10-week period, she tried 8 different medications, and the ups and downs were excruciating for her. Then her nurse practitioner told her about the GeneSight Test, and today Ronnie is a full-time caregiver for her amazing grandson. You'll hear more of her story in a bit, but with that, I will turn it over to Holly to get us started today.
Thank you for that introduction, Emily, and good afternoon, everyone. Thank you for joining our webinar today on how genetic testing can help with depression treatment. My name is Holly Johnson, and I am the Senior Manager of Medical Information at Myriad Neuroscience, makers of the GeneSight Test. The need to support America's mental health is urgent and increasing. And I'm excited to talk to you today about the GeneSight Test and how this simple genetic test can help your doctor understand how your genes may impact your outcomes with certain medications commonly prescribed to treat depression and other mental health conditions. Also joining me today is Ronnie Shapiro, one of our patients, who will be able to share her story and personal experience with depression and the GeneSight Test. Let's get started by talking a little bit about what your doctor considers today before prescribing medications. Now, there are a number of different factors that go into the medication selection process. Some of those factors include things like patient experience, adverse effects, family history, cost of the medication, what your diagnosis is, and adherence. While each of these factors are important, unfortunately, this approach doesn't always work. There was a large study conducted by the National Institute of Mental Health to assess the effectiveness of depression treatments. And that study found that less than 40% of patients achieved remission with their initial drug treatment. Keep in mind that remission is the ultimate goal of treating a depressed patient because that means they're no longer depressed. Now, this study also found that with each additional medication trial, that chance of remission decreases while the risk for side effects increases. So what we have here is repeated drug trials with limited efficacy and increasing rates of side effects. So that is clearly an issue with this trial and error approach. And unfortunately, it is what many patients experience because it can often be difficult to find a medication that alleviates your depressive symptoms without causing side effects. Now, why might that be? When medications don't work for a patient, there are some usual culprits that come to mind. Things like adherence, environmental factors, cost and insurance issues, as well as adverse effects. When a medication doesn't work for a patient, their doctor may try a number of different things. They may try giving them a new medication. They may try adjusting the dose, or they may try adding another medication to what the patient is already taking. This trial and error process can be very frustrating and time-consuming for many patients. However, it's also possible that our unique genetic makeup may be a factor in why medications may not work. And this is where the idea of pharmacogenomics comes into play. As defined by the National Institute of General Medical Sciences, pharmacogenomics is a field of research that studies how a person's genes affect how he or she respond to medications. Pharmacogenomic testing analyzes how a patient's genes may impact how they break down or respond to certain medications. And with pharmacogenomics, clinicians have an objective tool that can be used in combination with other clinical factors to help inform their medication selection process. And this may help reduce that trial and error process. The GeneSight test is a pharmacogenomic test that provides information about which medications may require dose adjustments, may be less likely to work, or may have an increased risk of side effects based on the patient's unique genetic makeup. So this simple genetic test can help your doctor understand how your genes may impact how you break down or respond to certain medications commonly prescribed to treat depression and other mental health conditions. This example here shows page 1 of the report, which shows the antidepressants. We also test for anxiolytics and hypnotics, antipsychotics, and mood stabilizers. And you can see that the medications are categorized based on the patient's unique genetic results. They will all start in that first category, the green use as directed. When medications remain in this category, it means we didn't find any variation in the patient's genes that we tested for that's likely to impact their outcomes with that medication. However, it doesn't mean that these are the best options for the patient. We can equate this to a green light. When you approach a green light, typically you would drive through as you normally would. However, you still have to be aware of your surroundings. So there could be debris in the road, a pothole, maybe a pedestrian walking. So similar for these medications that are in the green category, it means that we didn't find any genetic issues that are likely to impact outcomes with these medications, but there are still other factors to consider, such as patient's age, their diagnosis, other medications they may be taking that could lead to drug-drug interactions, things like that. Now, when the test does identify genetic variation that is likely to impact patient outcomes with medications, those medications will be moved out of that category and into either the yellow or red categories. Those are the moderate or significant gene-drug interaction categories. And when that happens, you see that they are labeled with one or more numbers. These are called clinical considerations. And these explain to the clinician why the medication was moved into that category. If we go back to our stoplight analogy, if we think about the medications in the yellow category, like approaching a yellow light. When you approach a yellow light, you typically slow down, proceed with caution. Same with these medications. The clinician may want to slow down a little bit and pay attention to what those clinical considerations are telling them about the medication. If we think about the red category medications, like a red light, when you approach a red light, you would stop, but sometimes you can turn right on red. So even these medications could still be an option for some patients, but the clinician may want to stop and carefully consider the information that's being presented with those clinical considerations. Because those clinical considerations are going to explain the reason why the medication has moved into that category and provide information about how medications affected by genetic variation might be best used. So let's just review a few examples of this. Number one indicates that the serum level of the medication may be too high. Lower doses may be required. This means that the patient is expected to break down that medication more slowly than normal. As a result, they may have too much of the medication in their body. Therefore, the clinician may want to consider using a lower dose. On the other hand, we have number two, which states that serum level may be too low and higher doses may be required. This means that the patient is expected to break down the medication more quickly than normal, and therefore they may not have enough of the medication in their body, and that may be ineffective for treatment. In that case, the clinician may want to consider giving a higher dose. So both of these have to do with issues in how the patient is expected to metabolize or break down the medication. If we look at number 4, that one tells us genotype may impact drug mechanism of action, or how the drug is working, and result in reduced efficacy. This means that the patient may be less likely to respond to the medication. Because this is actually an issue with how the medication is expected to work on the body, adjusting the dose may not necessarily improve efficacy. In order to categorize the medications and provide actionable recommendations, the GeneSight test looks at genes from 2 different categories: pharmacokinetic genes and pharmacodynamic genes. Pharmacokinetic genes provide information on what the body is doing to the medication. So how is the body metabolizing or breaking down the medication? It could be normally, could be more quickly than normal, or it could be more slowly than normal. Pharmacodynamic genes provide information on what the medication is doing to the body. So that can tell us about likelihood of response or risk of side effects with certain medications. The GeneSight test analyzes 12 genes total. 8 of them are pharmacokinetic genes. So those are going to be liver enzymes involved in breaking down medications. And 4 of them are pharmacodynamic genes. And those will provide us with information about patients' likelihood of response or risk of side effects with certain medications. Let's first take a deeper look at the pharmacokinetic genes. This image shows how your genetics can affect medication blood levels. There are 4 different metabolizer phenotypes that can result. If we first start by taking a look at the green, or the extensive or normal metabolizer phenotype. If someone is an extensive or normal metabolizer for a certain enzyme, that means they are predicted to break down some medications normally. And therefore, they would be expected to have normal amounts of medication at normal doses. If we draw our attention to the left, or the blue figure, that is the ultra-rapid metabolizer. If someone is an ultra-rapid metabolizer for a certain enzyme, they would be expected to break down some medications more quickly than normal. And therefore, they may not get enough medication at those normal doses. Then we have the slower end of the spectrum with intermediate and poor metabolizers. An intermediate metabolizer for an enzyme would be expected to break down some medications more slowly than normal. And therefore, they may have too much medication in their body at those normal doses. And then the poor metabolizer would be expected to break down some medications very slowly. In this case, they may also have too much medication in their system at those normal doses, and in some cases, they may experience side effects. Recall that we also look at pharmacodynamic genes, which provide information about likelihood of response or risk of side effects with certain medications. One of those pharmacodynamic genes is called SLC6A4. This is the serotonin transporter, which is shown by these orange cones. And then we have the serotonin, which is shown by the red dots. Serotonin is important in mood regulation. These serotonin transporters work by recycling serotonin. A commonly prescribed class of antidepressants, known as SSRIs, work by inhibiting that process. So those medications work by binding to these serotonin transporters, and that results in an increase in serotonin. When you're thinking about SLC6A4, you can think of it as having two different versions, long and short. That short version results in a decreased number of those serotonin transporters in the brain. That may make a patient less likely to respond to some of those SSRIs. The reason is because the SSRIs have less places to bind to have an effect. In this case, because it is an issue with how those medications are expected to work on the body, adjusting the dose may not necessarily improve efficacy. Second pharmacodynamic gene we test for is called HTR2A. This is the serotonin 2A receptor. Variation in this gene can predict if a patient may be at an increased risk of side effects when taking certain SSRIs, particularly one called Paxil. And lastly, we test for two HLA genes. HLA stands for human leukocyte antigen, and that complex plays an important role in immune regulation. We specifically test for HLA-B star 1502 and HLA-A star 3101. Testing for these genes can predict if a patient may be at an increased risk of developing severe skin reactions, such as Stevens-Johnson syndrome, when taking certain mood stabilizers, specifically Tegretol, Trileptal, and Lamictal for HLA-B star 1502, and Tegretol for HLA-A star 3101. Now, we've talked about a lot of information so far today, and you can imagine that interpreting all of this information can get complex pretty quickly. In fact, if we just look at the 12 genes that we test for on the GeneSight Psychotropic panel, there are over 330,000 possible combinations of phenotypes. So how do we analyze all of this information and provide actionable recommendations? We use what's called a combinatorial approach, which I will walk you through now. Medications often work through a unique combination of genetically controlled pathways. And the significance of those genes varies by medication. So let's just use a commonly prescribed SSRI, fluoxetine, or Prozac as an example. You can see here that Prozac is processed by 5 different genes. On the pharmacodynamic side, we have SLC6A4. And on the pharmacokinetic side, we have 4 different liver enzymes involved in breaking down that medication. We have CYP2D6, CYP2C19, CYP2C9, and CYP3A4. What you can see here by the different size circles is that each gene contributes differently to the overall metabolism and mechanism of action of Prozac. On top of that, a patient's unique genetics can impact the activity level of those pathways. Now, this is just a hypothetical example. This particular image would be different for every patient, but this illustrates that you could have a wide range of phenotypes. The green indicates a normal phenotype, the yellow an intermediate metabolizer phenotype, the red a poor metabolizer phenotype, and the blue an ultra-rapid metabolizer phenotype. So you have multiple genes involved in processing Prozac, each contributing differently to the overall metabolism and mechanism of action of Prozac, as you can see by those different size circles. And it's possible to have a wide range of phenotypes, ranging from normal to increased activity to decreased activity. Looking at this information, it would be difficult to predict how this patient may actually do on Prozac. But the GeneSight test is able to integrate all of this information and categorize Prozac appropriately based on the patient's specific genetic results, and then provide actionable recommendations in the form of those clinical considerations. In this case, the GeneSight test would categorize Prozac in the red, significant gene-drug interaction category for this patient. And it would be labeled with clinical considerations 1 and 6. 1 tells us that the serum level of that medication may be too high, so the patient is expected to break it down more slowly than normal, and therefore the clinician may want to consider using a lower dose. It also has number 6, which tells us that use of this drug may increase risk of side effects. In this particular case, it is due to the expected slow metabolism of the medication. So too much medication may build up in the patient's body, and that could potentially lead to side effects. The GeneSight Psychotropic test analyzes all 57 medications on our panel using this approach. And the results of the test can be used in combination with other clinical factors to help inform a clinician's medication selection and may help reduce that trial and error process. Now, to provide some real-world perspective about how this test has been used to help patients, I'd like to now turn it over to one of our patients, Ronnie Shapiro, who has been an incredible advocate for GeneSight. Ronnie, can you please share your story with us?
Thank you so much, Holly. I really appreciate the introduction. I listened to your presentation and was immediately struck by everything I went through and how far I have come since my GeneSight test. 10 years ago, I found myself in the middle of a very horrific personal situation that resulted in what I now know is depression and suicidality. All I know is that I was in such deep, excruciating pain, and I had no words to describe it. And most people don't really understand what that's like until they're in that bottom of that dark hole and just see no way out and no way to express how you're feeling. I was very fortunate in that I was hospitalized for the first time at an amazing institution. And the first person I saw was my first psychopharmacologist, who looked at me and said, "You don't belong here. You have too much to live for. We're going to get you on the right path." And she put me on my first psychotropic medication. And it was enough to put some ground under my feet and to get me back to my home and to my wonderful children that I had to live for. I then went out to try and find the best doctor I could to help me. I've spent most of my career working in hospitals, so I know that a good doctor is important. So I found a very well-known psychopharmacologist, and I went to see him, and I said, I can't live like this. I can't live, period. And he started me down a very, very difficult path. When you say the word side effect during a presentation, it sounds very neat and clean and clinical. But when you're living a side effect, it's a nightmare. I was put on multiple medications in a very short period of time, and side effects stop your life. Just stop it. Whether it's you can't stop running around, or you can't get out of bed, or you can't concentrate. And all this time you're trying to hold your life together and hold down a job and keep a family together and go through all your daily necessary obligations. And each medication comes with such severe side effects that until you've been through them, you really have no idea. And ultimately, the doctor looked at me and he said, I think you're making all of this up because I've given you great medications and all you've done is complain about every single one of them. And I was devastated because here I was fighting so hard. And what I got back was, it's all in my head. I knew enough to know that that was crazier than how I felt. So I was very, very lucky. I was recommended to a nurse practitioner who was able to administer the GeneSight test. This was 10 years ago, so she knew about it. And she said, it's a cheek swab. And I said, do I have to brush my teeth? And she said, absolutely not. So I said, okay, go for it. And she swabbed my cheeks. A week later, she made arrangements for me to meet with a psychiatrist, because a psychiatrist is required to read the results. And all I saw was green, yellow, and red. And he looked at me and he said, all of the medications that you had these horrific side effects to are all in the red column. So what a waste of my time and all of my energy. So I already was on 2 medications that were in the green or yellow column. And the doctor said, you need to add 1 more drug. And I remember I looked at him and I said, I don't know if I can do that. I've been through so much already. And he said, you have to trust the test. And I thought, okay, I'll trust the test. And I checked in with a friend every day. I got the prescription filled. And within 7 days, I was a completely different person. It was like somebody had just opened the windows and let sunlight in. And I could breathe. I could smile. I could remember what it was like to have a normal life. And when you're depressed, a normal life becomes so far removed from reality that you can't even imagine getting through the next 5 minutes, much less the next day. I learned how to advocate for myself. And that is why I have agreed to work with GeneSight, do everything I can to help get the word out about GeneSight, because while it's not perfect, it's the best thing that can happen to people. You may not feel like crawling to the closet to put on clothes, but I encourage every single person out there to crawl to your computer and get in touch with GeneSight, find a doctor. If you can't do it, ask people to help you. There are plenty of people out there. When you say, I can't do this alone, I need help, all they have to do is contact GeneSight, go to the website, find a doctor, and give it a chance, because life is so much better on the other side. I can't even begin to tell you. And I have to thank GeneSight for where I am today. Yes, I have quit my job and I am taking care of my amazing grandson. And I love every moment of it. And the team at GeneSight has made my life worth living. And for that, I will eternally be grateful.
Thank you so much, Ronnie. Thank you for sharing that story. That's incredible. Depression is something that can and should be treated. If you're struggling with depression and are interested in the GeneSight test, I would encourage you to talk to your doctor Any prescribing clinician can order the GeneSight test. We've also created a discussion guide that can be found on our website that can help with that conversation. And you can use our Find a Provider portal to see who may be using the GeneSight test in your area. If you do decide to discuss the GeneSight test with your doctor, there are some important tips to keep in mind. First, it would be important to take along any information the doctor or staff may need to see, such as names and contact information of your past or other providers, records showing past or current medications, and dietary supplements. Also, don't be afraid to share how your current depression treatment is working for you and where it may be falling short. As Ronnie mentioned, I think you said something that really resonated with me, being an advocate for yourself. So don't be afraid to share those things. She also mentioned the support of a friend. The support of a friend or family member can help facilitate the conversation with your doctor and really help act as a co-advocate for your care at your next appointment. If you are interested in the GeneSight test, discuss whether you might be a good candidate with your doctor. And if you're not able to see your doctor in person, the GeneSight test can be ordered by your healthcare provider and sent directly to your home. If you need help finding a healthcare provider, you can use our Find a Provider portal on our website to find one near you. As we start to wrap up this webinar, there are 5 things about GeneSight that I'd really like to leave you with. One is that the results of the test can inform your doctor about genes that may impact how you metabolize or respond to certain medications commonly prescribed to treat depression and other mental health conditions. The results of the test are intended to supplement other information considered by your healthcare provider within the context of a comprehensive medical assessment. So the results can be used in combination with those other clinical factors to help inform a clinician's treatment decisions and may help reduce that trial and error period that can sometimes last for months or even years. After we receive your sample, your doctor will typically get your test results within about 2 days. More than 1 million people have taken the GeneSight test, and many healthcare plans, including Medicare, cover the GeneSight Psychotropic test. There's no cost to the provider to administer the test, and we do offer the GeneSight Promise for patients, meaning that if your cost is expected to be more than $330, we would contact you before processing the test. We also have a financial assistance program available as well. It's also important to note that we take privacy very seriously. We analyze all GeneSight psychotropic and MTHFR tests at our own accredited lab, so we can ensure the quality and security of your test. Your genetic information is private and protected through various federal laws, including HIPAA and GINA, that ensure the security of your personal and genetic information. And all samples are destroyed within 60 days of processing. That brings us to the end of our webinar, so I am happy to take any questions that you may have. Also, if you think of any questions after this webinar, you can feel free to contact our medical information team at the email or phone number shown on the screen. Thank you.
Great. Thank you both so much for sharing. Yes, so we do have time for questions. So as I said, everyone, y'all are welcome to ask questions in the chat box, and we do have a few already. So one of the first ones, are there any other characteristics that may predict how rapidly a person would break down a medication? Like any signs that people could look for short of doing genetic testing?
There's no really direct signs. I don't think that could predict if a patient may break down a medication more rapidly. The genetic piece is one component that can tell us if your genetics may cause you to break down certain medications more quickly than normal. There are other factors that can also cause you to break down some medications more quickly. Those could be things like drug-drug interactions, drug-food interactions, and things like that. Sometimes if a medication is not working for a patient at the standard dose, one reason could be that they are breaking it down more quickly than normal. But in order to determine if there's a genetic reason for that, then we would have to do the genetic test. Good question.
Is the testing covered by Medicaid or other insurances?
Some insurances do cover the test. Typically with Medicaid, there is a $0 out-of-pocket cost. And we do have the GeneSight promise for patients. So 95% of patients pay $330 or less. And if your cost is, the GeneSight promise is if your cost is expected to be more than $330, we would contact you before processing the test.
I know that when I had the test done, it didn't cost me a penny out of pocket, and my nurse practitioner was able to find out before she administered the test what the cost would be.
Great. And then another interesting question. Do you currently have to be on medication to get an accurate reading?
That is a good question. You do not have to be on medication to get an accurate reading. So the test is a simple cheek swab that is analyzing your DNA. And so the results are going to be based on your DNA, and those aren't going to change throughout your life. So that's not dependent on whether or not you're currently taking medications.
Great. And is the degree of depression that someone has a factor in being recommended for the testing? So could someone with mild depression still get the testing done?
Yes, anyone could get the testing done. Again, I would encourage you to speak with your doctor to determine if you're a good candidate for the testing. But yes, someone with mild depression could still benefit from the testing if their doctor is considering medication as a form of treatment, because the results can help inform their medication selection.
Great. And then a more specific one. So someone had this test done a few years ago and is wondering if there have been further refinements or developments since then, and if it's worth getting tested again.
Again, I would encourage you to talk to your doctor about that to determine, what changes or additions have been made to the test, because it really depends on when your original test was done. And whether those changes or additions would be relevant to your treatment. So the last time that we added medications and genes to the panel was at the end of 2015. And then since then, there have been some other minor changes and additions. For example, we've added a couple antipsychotics since then. So it depends on when you were tested and whether those additions or changes that happened during that time would be relevant for your treatment. So again, it would be a good idea to discuss that with your doctor.
Great. And is there anything that would automatically disqualify someone for testing?
Something that would automatically disqualify someone for testing? Not necessarily, no. There are certain factors that may make a patient more or less ideal candidates for testing. And so I wouldn't say it would necessarily disqualify the patient, but if there is a patient who is responding well to their current medication, then the test may not be that useful for them, because if they're responding well to their medication, that's great. That's what we want to see. And then there would be no reason to make any changes to that treatment regimen, where the real utility of the test is to help inform a clinician's medication selection. So to help get patients off of medications they're not doing well on and inform that next medication selection.
Right. And slightly different than a medication note, but can this approach be used to indicate someone's reactions to vaccinations?
No, it cannot be used to indicate a reaction to a vaccination.
Great. It looks like that's all the questions we have for right now. We do still have time, so we can hang on for a few minutes if anyone has any last minute questions they want to toss in there. or Dr. Johnson or Ronnie, if you have any last words you'd like to share.
Yeah, I guess going back to one of your previous questions about something that would disqualify a patient, there are a couple other things to keep in mind in addition to what I mentioned earlier. One is, for example, if you're a patient who's received a liver transplant. In that case, you will have the liver enzyme activity of the donor, but the GeneSight test is analyzing your DNA from a cheek swab. So it's going to be looking at your DNA, but you're going to be having the enzyme activity of the donor. Therefore, those pharmacokinetic genes we spoke about, that section would not be accurate for a liver transplant patient. So for those patients, they could still receive the test, but only if their doctor thinks enough benefit could be gained from the pharmacodynamic portion of the test, because that is the only part that would be accurate for the liver transplant patient.
Great, and we do have a few more questions coming in now.
Great.
So do drug manufacturers and developers take this information into account when developing new drugs to develop more effective drugs for a wider range of people?
That is a great question. I think drug manufacturers take a lot of different factors into consideration. I can't say for certain if they're, taking this type of information into consideration, but it seems they are. If we think about some of the newer drugs that have come out on the market, where they're typically more being metabolized by a certain enzyme called CYP3A4, and that particular enzyme, most people don't have variation in that gene. And so it seems like they're starting to design drugs that that go through more enzymes that maybe don't have a lot of variation, like 3A4, versus some of the other medications that might be predominantly metabolized by something called CYP2D6, where we know that a lot of patients have variation in that gene. So it seems like they are starting to take this type of information into consideration.
Great. And are there any restrictions in terms of age? Does this apply to adolescents and young adults, or is it not recommended for those age groups, or is it suited for everyone?
Another great question. So again, the test is analyzing your DNA, which will not change throughout your life. So there's not necessarily an age restriction. However, there are always other factors to keep in mind when considering the genetic results. So someone who's a pediatric patient could still receive the test, but the clinician will want to take age into consideration. So it's still going to show all 57 medications that are on the report, but not all of those are going to be FDA approved for the pediatric population. Another thing to keep in mind is while the genetic results will be accurate, there are some differences in how enzymes act at different stages in life. So doctor would also need to take that factor into consideration as well. And then lastly, I just wanted to point out that we do have multiple clinical studies that have evaluated the utility of the GeneSight Psychotropic test. All of those studies have been done in adults age 18 and over. So we don't have the clinical studies in the pediatric population, but again, those patients could still receive the test. There's just some other factors the clinician would also want to keep in mind in addition to the genetic results.
Great. And then some questions about the future of GeneSight. Is there any possibility with genetic testing going forward to develop specific information for custom antidepressants or custom medications?
Is the question more around using genetic information to actually develop a medication?
I think so.
Yeah.
Based on an individual's, yeah.
Yeah, that is an interesting thought. I don't think at this time they would be able to use information to kind of develop a custom antidepressant. And if we think about what pharmacogenomic testing is and what its utility is, it's really more about identifying potential issues with medications rather than identifying a medication that's going to work best for the patient. And then one other thing to keep in mind with that as well is that genetics is an important piece of the puzzle, but it's only one piece of the puzzle. So there are a lot of other factors to take into consideration as well that can affect medication response and susceptibility to side effects.
Great. And is the test typically done by a primary care doctor, or if you're seeing a psychiatrist or nurse practitioner, can they perform those as well?
Yes, so it can be ordered by any clinician who can prescribe medications. So it could be primary care provider, psychiatrist, nurse practitioner, anyone that can prescribe medications can order the test.
Great. And so if someone's interested in doing that, how should they start that conversation with their doctor? And can their doctor refuse to do the test?
Yeah, another good question. So I think using the tips we discussed towards the end of the webinar is a good starting point. We also do have that doctor discussion guide we created to help facilitate that conversation about if you're interested in the GeneSight test. That can be downloaded from our website. And yes, it is possible that even after all of that, the clinician may still not want to order the test. In that case, we would recommend perhaps using our Find a Provider portal on our website that shows other clinicians in your area who are using the GeneSight test and have expressed the willingness to discuss taking the GeneSight test with new patients.
It's important that patients don't give up, ever. There's no reason to. For the question about mild depression, nobody should be living with depression while GeneSight exists. There are ways to go about gaining a life and making it worth living, and it's out there, so use it.
Great. And are patients able to obtain a copy of their results, or is that only accessible to clinicians?
Patients can also obtain a copy. We would encourage patients to receive the copy through their healthcare provider, but they can also contact our customer service team for a copy of the report as well. And we do have a dedicated team of genetic counselors that can help patients interpret the results of their report and answer any questions they may have.
Great. All right, looks like that's about it for questions, so we'll wrap there. Thank you both for such a wonderful presentation, and thank you to everyone who joined us today. I will be in touch with everyone in the next few days to get you all the recording and a copy of the slides, and we'll also include that link to request a certificate of attendance in there as well. Stay safe and healthy and enjoy the rest of your afternoon. Thanks, everyone.
Thank you so much.
Thank you.